Hi, my name is Anne, and I'm going to be presenting on COVID-19 mental health status and adherence to public health guidelines among the elderly population in the United States. The elderly adults have the highest risk for mortality from COVID-19 because they have a lot of comorbidities and susceptibility to chronic health issues. For the mental health of the elderly do experience more social isolation than other age groups before COVID-19, and they also have susceptibility to depression due to the zinc deficiency. This study aimed to examine if the COVID-19 pandemic has contributed to a lessened mental health status for the elderly with positive COVID-19 diagnoses or symptoms. Our hypothesis was that the elderly people who had COVID-19 were more likely to follow public health guidelines and more likely to experience depression, anxiety, loneliness, and sleep disturbances compared to those who did not have COVID-19. We analyzed data from the National Health Aging Trend Study, which is a cross-sectional study conducted using COVID-19 questionnaires. The dependent variables looked at were depression, anxiety, loneliness, sleep behaviors, and public health guidelines, whereas the main independent variables included being COVID-19 positive and severity of COVID-19 symptoms. Other independent variables included comorbidities, demographic characteristics, and social activities. The statistics were looked at with descriptive statistics, bivariate statistics using chi-square tests, and also multiple logistic regression for examining the associations between dependent and independent variables. Statistical tests were taken and performed using SAS, taking into consideration the design and sample weight with a p-value of less than 0.05 being considered significant. Significantly higher percentages of these positive diagnoses were found amongst those who were Hispanic, went up to high school but no diploma, had income less than $25,000, never married, did not have other prescription coverage, had Medicaid, reported poor health, diabetes, had dementia or Alzheimer's, slept more than usual relative to other groups. For the depression outcome, significantly higher percentages were found amongst those who had severe COVID-19 symptoms and very severe COVID-19 symptoms, female, separated or divorced, poor health, obese, had less sleep compared to usual, arthritis, osteoporosis, lung disease, and delayed mental health care relative to other groups. For the anxiety outcome, significantly higher percentages of anxiety was found amongst those who had severe COVID-19 symptoms, ages 70 to 74, female, poor health, obese, had less sleep compared to usual, had arthritis, had osteoporosis, had lung disease, who did not have dementia or Alzheimer's, and delayed mental health care relative to other groups. For the loneliness outcome, significantly higher percentages of loneliness was found amongst those who were white, non-Hispanic, female, those with professional degrees, separated or divorced, had Medigap or supplemental coverage, who have not had a heart attack, had arthritis, had osteoporosis, had lung disease, delayed mental health care, and had less sleep compared to usual. For the bivariate statistics by the public health measures, not wearing a mask, significantly higher percentages were found amongst those who were ages 65 to 69, male who did not have Medicaid, had no osteoporosis, had diabetes, had cancer. For not washing hands, ages 65 to 69, male, had dementia or Alzheimer's, did not have osteoporosis, and had no regular doctor. Not staying 6 feet away from other people who had no prescription coverage, had negative COVID-19 tests, white, non-Hispanic, high school graduate, had cancer, did not see a doctor last year, and delayed mental health care. For multiple logistic regression, for the COVID-19 diagnosis, there were no significant differences for those who have COVID-19 and those who did not have COVID-19 in the depression, anxiety, loneliness, and sleep outcomes. However, for severity of COVID-19 symptoms, those who had severe or very severe COVID-19 symptoms had a 6.6 times higher likelihood of feeling moderate to severe depression relative to those with no COVID symptoms. For loneliness, those who had mild or moderate COVID symptoms had a 5.9 times likelihood of feeling more lonely relative to those with no COVID symptoms. And for anxiety and sleep, there were no associations between these outcomes and the severity of COVID-19 symptoms. The elderly are affected disproportionately by COVID-19, both physically and mentally. Severe or very severe COVID-19 symptoms increase the likelihood of depression. Mild or moderate COVID-19 symptoms increase the likelihood of loneliness. Further research to examine the long-term effect of COVID-19 on the psychological health of the elderly population after the pandemic is needed. Qualitative research to examine the feelings and perceptions of the elderly population about the pandemic will be helpful to address their needs. Thank you for listening to my presentation. If you have any questions, you can contact me through this email.